Cancer causes cells to divide uncontrollably. This can result in tumors, damage to the immune system, and other impairment that can be fatal. In the United States, an estimated 15.5 million trusted source people with a history of cancer were living as of January 1, 2016, according to a 2018 report from the American Cancer Society. In this article, we examine types of cancer, how the disease develops, and the many treatments that help improve the quality of life and survival rates. What is cancer? Photo edited by Stephen Kelly, Science Photo Library, Steve Schmeissner, /CSA Images, /Getty Images. Cancer is a broad term. It describes the disease that results when cellular changes cause the uncontrolled growth and division of cells. Some types of cancer cause rapid cell growth, while others cause cells to grow and divide at a slower rate. Certain forms of cancer result in visible growths called tumors, while others, such as leukemia, do not. Most of the body's cells have specific functions and fixed lifespans. While it may sound like a bad thing, cell death is part of a natural and beneficial phenomenon called apoptosis. A cell receives instructions to die so that the body can replace it with a newer cell that functions better. Cancerous cells lack the components that instruct them to stop dividing and to die. As a result, they build up in the body, using oxygen and nutrients that would usually nourish other cells. Cancerous cells can form tumors, impair the immune system, and cause other changes that prevent the body from functioning regularly. Cancerous cells may appear in one area, then spread via the lymph nodes. These are clusters of immune cells located throughout the body. Causes. There are many causes of cancer, and some are preventable. For example, over 480,000 people trusted source die in the U.S. each year from smoking cigarettes, according to data reported in 2014. In addition to smoking, risk factors for cancer include heavy alcohol consumption, excess body weight, physical inactivity, poor nutrition. Other causes of cancer are not preventable. Currently, the most significant unpreventable risk factor is age. According to the American Cancer Society, doctors in the U.S. diagnose 87% trusted source of cancer cases in people ages 50 years or older. Is cancer genetic? Genetic factors can contribute to the development of cancer. A person's genetic code tells their cells when to divide and expire. Changes in the genes can lead to faulty instructions, and cancer can result. Genes also influence the cell's production of proteins, and proteins carry many of the instructions for cellular growth and division. Some genes change proteins that would usually repair damaged cells. This can lead to cancer. If a parent has these genes, they may pass on the altered instructions to their offspring. Some genetic changes occur after birth, and factors such as smoking and sun exposure can increase the risk. Other changes that can result in cancer take place in the chemical signals that determine how the body deploys or expresses specific genes. Finally, a person can inherit a predisposition for a type of cancer. A doctor may refer to this as having a hereditary cancer syndrome. Inherited genetic mutations significantly contribute to the development of 5 to 10% trusted source of cancer cases. Treatments. The side effects of chemotherapy include hair loss. However, advances in treatment are improving the outlook for people with cancer. Innovative research has fueled the development of new medications and treatment technologies. Doctors usually prescribe treatments based on the type of cancer, its stage at diagnosis, and the person's overall health. Below are examples of approaches to cancer treatment. Chemotherapy aims to kill cancerous cells with medications that target rapidly dividing cells. The drugs can also help shrink tumors, but the side effects can be severe. Hormone therapy involves taking medications that change how certain hormones work or interfere with the body's ability to produce them. When hormones play a significant role, as with prostate and breast cancers, this is a common approach. Immunotherapy uses medications and other treatments to boost the immune system and encourage it to fight cancerous cells. Two examples of these treatments are checkpoint inhibitors and adoptive cell transfer. Precision medicine, or personalized medicine, is a newer, developing approach. It involves using genetic testing to determine the best treatments for a person's particular presentation of cancer. Researchers have yet to show that it can effectively treat all types of cancer, however. Radiation therapy uses high-dose radiation to kill cancerous cells. Also, a doctor may recommend using radiation to shrink a tumor before surgery or reduce tumor-related symptoms. Stem cell transplant can be especially beneficial for people with blood-related cancers, such as leukemia or lymphoma. It involves removing cells, such as red or white blood cells, that chemotherapy or radiation has destroyed. Lab technicians then strengthen the cells and put them back into the body. Surgery is often a part of a treatment plan when a person has a cancerous tumor. Also, a surgeon may remove lymph nodes to reduce or prevent the disease's spread. Targeted therapies perform functions within cancerous cells to prevent them from multiplying. They can also boost the immune system. Two examples of these therapies are small molecule drugs and monoclonal antibodies. Doctors will often employ more than one type of treatment to maximize effectiveness. Types. Smoking increases the risk of many different types of cancer. The most common type trusted source of cancer in the U.S. is breast cancer, followed by lung and prostate cancers, according to the National Cancer Institute, which excluded non-melanoma skin cancers from these findings. Each year, more than 40,000 people in the country receive a diagnosis of one of the following types of cancer: bladder, colon and rectal, endometrial, kidney, leukemia, liver, melanoma, non-Hodgkin's lymphoma, pancreatic, thyroid. Other forms are less common. According to the National Cancer Institute, there are over 100 types trusted source of cancer. Cancer development and cell division. Doctors classify cancer by its location in the body, the tissues that it forms in. For example, sarcomas develop in bones or soft tissues, while carcinomas form in cells that cover internal or external surfaces in the body. Basal cell carcinomas develop in the skin, while adenocarcinomas can form in the breast. When cancerous cells spread to other parts of the body, the medical term for this is metastasis. A person can also have more than one type of cancer at a time. Outlook. Improvements in cancer detection, increased awareness of the risks of smoking, and a drop in tobacco use have all contributed to a year-on-year decrease in the number of cancer diagnoses and deaths. According to the American Cancer Society, the overall cancer death rate declined by 26% trusted source between 1991 and 2015. When a person has cancer, the outlook will depend on whether the disease has spread and on its type, severity, and location. Takeaway. Cancer causes cells to divide uncontrollably. It also prevents them from dying at the natural point in their life cycle. Genetic factors and lifestyle choices, such as smoking, can contribute to the development of the disease. Several elements affect the ways that DNA communicates with cells and directs their division and death. After non-melanoma skin cancer, breast cancer is the most common type in the U.S. However, lung cancer is the leading cause of cancer-related death. Treatments are constantly improving. Examples of current methods include chemotherapy, radiation therapy, and surgery. Some people benefit from newer options, such as stem cell transplantation and precision medicine. The diagnosis and death rates of cancer are dropping yearly. Breast cancer is a disease in which cells in the breast grow out of control. There are different kinds of breast cancer. The kind of breast cancer depends on which cells in the breast turn into cancer. Breast cancer can begin in different parts of the breast. A breast is made up of three main parts: lobules, ducts, and connective tissue. The lobules are the glands that produce milk. The ducts are tubes that carry milk to the nipple. The connective tissue, which consists of fibrous and fatty tissue, surrounds and holds everything together. Most breast cancers begin in the ducts or lobules. Breast cancer can spread outside the breast through blood vessels and lymph vessels. When breast cancer spreads to other parts of the body, it is said to have metastasized. Kinds of breast cancer. The most common kinds of breast cancer are invasive ductal carcinoma. The cancer cells begin in the ducts and then grow outside the ducts into other parts of the breast tissue. Invasive cancer cells can also spread or metastasize to other parts of the body. Invasive lobular carcinoma. Cancer cells begin in the lobules and then spread from the lobules to the breast tissues that are close by. These invasive cancer cells can also spread to other parts of the body. There are several other less common kinds of breast cancer, such as Paget's disease, medullary, mucinous, and inflammatory breast cancer. Ductal carcinoma in situ, CIS, is a breast disease that may lead to invasive breast cancer. The cancer cells are only in the lining of the ducts and have not spread to other tissues in the breast. What are the symptoms of breast cancer? Photo of a patient talking to her doctor. If you have any symptoms that worry you, be sure to see your doctor right away. Different people have different symptoms of breast cancer. Some people do not have any signs or symptoms at all. Some warning signs of breast cancer are new lump in the breast or underarm, armpit, thickening or swelling of part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area or the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk, including blood, any change in the size or the shape of the breast, pain in any area of the breast. Keep in mind that these symptoms can happen with other conditions that are not cancer. If you have any signs or symptoms that worry you, be sure to see your doctor right away. What is a normal breast? No breast is typical. What is normal for you may not be normal for another woman. Most women say their breasts feel lumpy or uneven. The way your breasts look and feel can be affected by getting your period, having children, losing or gaining weight, and taking certain medications. Breasts also tend to change as you age. For more information, see the National Cancer Institute's Breast Changes and Conditions. What do lumps in my breast mean? Many conditions can cause lumps in the breast, including cancer. But most breast lumps are caused by other medical conditions. The two most common causes of breast lumps are fibrocystic breast condition and cysts. Fibrocystic condition causes non-cancerous changes in the breast that can make them lumpy, tender, and sore. Cysts are small fluid-filled sacs that can develop in the breast. What are the risk factors for breast cancer? Studies have shown that your risk for breast cancer is due to a combination of factors. The main factors that influence your risk include being a woman and getting older. Most breast cancers are found in women who are 50 years old or older. Some women will get breast cancer even without any other risk factors that they know of. Having a risk factor does not mean you will get the disease, and not all risk factors have the same effect. Most women have some risk factors, but most women do not get breast cancer. If you have breast cancer risk factors, talk with your doctor about ways you can lower your risk and about screening for breast cancer. Risk factors you cannot change. Getting older. The risk for breast cancer increases with age. Most breast cancers are diagnosed after age 50. Genetic mutations. Women who have inherited changes, mutations, to certain genes, such as BRCA1 and BRCA2, are at higher risk of breast and ovarian cancer. Reproductive history. Starting menstrual periods before age 12 and starting menopause after age 55 expose women to hormones longer, raising their risk of getting breast cancer. Having dense breasts. Dense breasts have more connective tissue than fatty tissue, which can sometimes make it hard to see tumors on a mammogram. Women with dense breasts are more likely to get breast cancer. Personal history of breast cancer or certain non-cancerous breast diseases. Women who have had breast cancer are more likely to get breast cancer a second time. Some non-cancerous breast diseases such as atypical hyperplasia or lobular carcinoma in situ are associated with a higher risk of getting breast cancer. Family history of breast or ovarian cancer. A woman's risk for breast cancer is higher if she has a mother, sister, or daughter, first-degree relative, or multiple family members on either her mother's or father's side of the family who have had breast or ovarian cancer. Having a first-degree male relative with breast cancer also raises a woman's risk. Previous treatment using radiation therapy. Women who had radiation therapy to the chest or breasts, for instance, treatment of Hodgkin's lymphoma, before age 30 have a higher risk of getting breast cancer later in life. Exposure to the drug diethylstilbestrol, DES. DES was given to some pregnant women in the United States between 1940 and 1971 to prevent miscarriage. Women who took DES, or whose mothers took DES while pregnant with them, have a higher risk of getting breast cancer. Risk factors you can change. Photo of two women walking with two dumbbells, one on each hand. Being physically active can help lower your risk of getting breast cancer. Not being physically active. Women who are not physically active have a higher risk of getting breast cancer. Being overweight or having obesity after menopause. Older women who are overweight or have obesity have a higher risk of getting breast cancer than those at a healthy weight. Taking hormones. Some forms of hormone replacement therapy, those that include both estrogen and progesterone, taken during menopause, can raise risk for breast cancer when taken for more than 5 years. Certain oral contraceptives, birth control pills, also have been found to raise breast cancer risk. Reproductive history. Having the first pregnancy after age 30, not breastfeeding, and never having a full-term pregnancy can raise breast cancer risk. Drinking alcohol. Studies show that a woman's risk for breast cancer increases with the more alcohol she drinks. Research suggests that other factors such as smoking, being exposed to chemicals that can cause cancer, and changes in other hormones due to night shift working also may increase breast cancer risk. Who is at high risk for breast cancer? Having a family history increases cancer risk in both genders. This blog post explains how breast cancer can be passed down through your family, increasing risk for both men and women. If you have a strong family history of breast cancer or inherited changes in your BRCA1 and BRCA2 genes, you may have a high risk of getting breast cancer. You may also have a high risk for ovarian cancer. Talk to your doctor about ways to reduce your risk, such as medicines that block or decrease estrogen in your body, or surgery. What can I do to reduce my risk of breast cancer? Many factors over the course of a lifetime can influence your breast cancer risk. You can't change some factors, such as getting older or your family history, but you can help lower your risk of breast cancer by taking care of your health in the following ways. Keep a healthy weight. Be physically active. Choose not to drink alcohol or drink alcohol in moderation. If you are taking, or have been told to take, hormone replacement therapy or oral contraceptives, birth control pills, ask your doctor about the risks and find out if it is right for you. Breastfeed your children if possible. If you have a family history of breast cancer or inherited changes in your BRCA1 and BRCA2 genes, talk to your doctor about other ways to lower your risk. Staying healthy throughout your life will lower your risk of developing cancer and improve your chances of surviving cancer if it occurs. What is breast cancer screening? Breast cancer screening means checking a woman's breasts for cancer before there are signs or symptoms of the disease. All women need to be informed by their healthcare provider about the best screening options for them. When you are told about the benefits and risks of screening and decide with your healthcare provider whether screening is right for you, and if so, when to have it, this is called informed and shared decision-making. Although breast cancer screening cannot prevent breast cancer, it can help find breast cancer early, when it is easier to treat. Talk to your doctor about which breast cancer screening tests are right for you, and when you should have them. Breast cancer screening recommendations. The United States Preventive Services Task Force, USPSTF, is an organization made up of doctors and disease experts who look at research on the best way to prevent diseases and make recommendations on how doctors can help patients avoid diseases or find them early. The USPSTF recommends that women who are 50 to 74 years old and are at average risk for breast cancer get a mammogram every 2 years. Women who are 40 to 49 years old should talk to their doctor or other healthcare provider about when to start and how often to get a mammogram. Women should weigh the benefits and risks of screening tests when deciding whether to begin getting mammograms before age 50. Breast cancer screening tests. Where can I go to get screened? You can get screened for breast cancer at a clinic, hospital, or doctor's office. If you want to be screened for breast cancer, call your doctor's office. They can help you schedule an appointment. Most health insurance plans are required to cover screening mammograms every 1 to 2 years for women beginning at age 40 with no out-of-pocket cost, like a copay, deductible, or coinsurance. Find a mammography facility near you. Are you worried about the cost? CDC offers free or low-cost mammograms. Find out if you qualify. Mammogram. A mammogram is an X-ray of the breast. For many women, mammograms are the best way to find breast cancer early, when it is easier to treat and before it is big enough to feel or cause symptoms. Having regular mammograms can lower the risk of dying from breast cancer. At this time, a mammogram is the best way to find breast cancer for most women of screening age. Breast magnetic resonance imaging, MRI. A breast MRI uses magnets and radio waves to take pictures of the breast. Breast MRI is used along with mammograms to screen women who are at high risk for getting breast cancer. Because breast MRIs may appear abnormal even when there is no cancer, they are not used for women at average risk. Other exams. Clinical breast exam. A clinical breast exam is an examination by a doctor or nurse who uses his or her hands to feel for lumps or other changes. Breast self-awareness. Being familiar with how your breasts look and feel can help you notice symptoms such as lumps, pain, or changes in size that may be of concern. These could include changes found during a breast self-exam. You should report any changes that you notice to your doctor or healthcare provider. Having a clinical breast exam or doing a breast self-exam has not been found to lower the risk of dying from breast cancer. Benefits and risks of screening. Every screening test has benefits and risks, which is why it's important to talk to your doctor before getting any screening test, like a mammogram. Benefit of screening. The benefit of screening is finding cancer early, when it's easier to treat. Risks of screening. Harms can include false positive test results, when a doctor sees something that looks like cancer but is not. This can lead to more tests, which can be expensive, invasive, time-consuming, and may cause anxiety. Tests also can lead to overdiagnosis, when doctors find a cancer that would not have gone on to cause symptoms or problems, or even may go away on its own. Treatment of these cancers is called overtreatment. Overtreatment can include treatments recommended for breast cancer, such as surgery or radiation therapy. These can cause unnecessary and unwanted side effects. Other potential harms from breast cancer screening include pain during procedures and radiation exposure from the mammogram test itself. While the amount of radiation in a mammogram is small, there may be risks with having repeated X-rays. Mammograms may also miss some cancers, called false negative test results, which may delay finding a cancer and getting treatment. What is a mammogram? A mammogram is an X-ray picture of the breast. Doctors use a mammogram to look for early signs of breast cancer. Regular mammograms are the best tests. Doctors have to find breast cancer early, sometimes up to 3 years, before it can be felt. How is a mammogram done? You will stand in front of a special X-ray machine. A technologist will place your breast on a plastic plate. Another plate will firmly press your breast from above. The plates will flatten the breast, holding it still while the X-ray is being taken. You will feel some pressure. The steps are repeated to make a side view of the breast. The other breast will be X-rayed in the same way. You will then wait while the technologist checks the X-rays to make sure the pictures do not need to be redone. Keep in mind that the technologist cannot tell you the results of your mammogram. Each woman's mammogram may look a little different because all breasts are a little different. What does having a mammogram feel like? Having a mammogram is uncomfortable for most women. Some women find it painful. A mammogram takes only a few moments, though, and the discomfort is over soon. What you feel depends on the skill of the technologist, the size of your breasts, and how much they need to be pressed. Your breasts may be more sensitive if you are about to get or have your period. A doctor with special training, called a radiologist, will look at the X-ray for early signs of breast cancer or other problems. Tips for getting a mammogram. Try not to have your mammogram the week before you get your period or during your period. Your breasts may be tender or swollen then. On the day of your mammogram, don't wear deodorant, perfume, or powder. These products can show up as white spots on the X-ray. Some women prefer to wear a top with a skirt or pants instead of a dress. You will need to undress from your waist up for the mammogram. When will I get the results of my mammogram? You will usually get the results within a few weeks, although it depends on the facility. A radiologist reads your mammogram and then reports the results to you and your doctor. If there is a concern, you will hear from the mammography facility earlier. Contact your healthcare provider or the mammography facility if you do not receive a report of your results within 30 days. An example of a normal mammogram. An example of a normal mammogram. Each woman's mammogram may look a little different because all breasts are a little different. What happens if my mammogram is normal? Continue to get mammograms according to recommended time intervals. Mammograms work best when they can be compared with previous ones. This allows the radiologist to compare them to look for changes in your breasts. What happens if my mammogram is abnormal? An abnormal mammogram does not always mean that there is cancer. But you will need to have additional mammograms, tests, or exams before the doctor can tell for sure. You may also be referred to a breast specialist or a surgeon. It does not necessarily mean you have cancer or need surgery. These doctors are experts in diagnosing breast problems. Doctors will do follow-up tests to diagnose breast cancer or to find that there is no cancer. Where can I get a mammogram and who can I talk to if I have questions? If you have a regular doctor, talk to him or her. Contact the National Cancer Institute. For Medicare information, you can call 1-800-MEDICARE 1-800-633-4227 or visit the Centers for Medicare and Medicaid Services. CDC's National Breast and Cervical Cancer Early Detection Program works with health departments and other groups to provide low-cost or free mammograms to women who qualify. Find out if you qualify. More information. What does it mean to have dense breasts? A mammogram shows how dense your breasts are. When you get the results of your mammogram, you may also be told if your breasts have low or high density. Women with dense breasts have a higher risk of getting breast cancer. What are the parts of the breast? A woman's breast has 3 kinds of tissue. Fibrous tissue holds the breast tissue in place. Glandular tissue is the part of the breast that makes milk, called the lobes. The tubes that carry milk to the nipple are called ducts. Together, fibrous and glandular tissue are called fibroglandular tissue. Fatty tissue fills the space between the fibrous tissue, lobes, and ducts. It gives the breasts their size and shape. What is breast density? Breast density reflects the amount of fibrous and glandular tissue in a woman's breasts compared with the amount of fatty tissue in the breasts, as seen on a mammogram. On a mammography report, breast density is assigned to one of the following 4 categories. The breasts are almost entirely fatty, about 10% of women. A few areas of dense tissue are scattered through the breasts, about 40% of women. The breasts are evenly dense throughout, about 40% of women. The breasts are extremely dense, about 10% of women. Women in the first 2 categories are said to have low density, non-dense, or fatty breasts. Women in the second 2 categories are said to have high density or dense breasts. About half of women who are 40 years old or older have dense breasts. Why is breast density important? 2 mammograms. The image on the left shows a mostly fatty breast, and the image on the right shows a dense breast. View larger. Breast cancer risk. Women with dense breasts have a higher chance of getting breast cancer. The more dense your breasts are, the higher your risk. Scientists don't know for sure why this is true. Breast cancer patients who have dense breasts are not more likely to die from breast cancer than patients with non-dense, fatty breasts. Mammograms. Dense tissue can hide cancers. Fibrous and glandular tissue looks white on a mammogram. So does a possible tumor. Because it's hard to tell the difference between a tumor and dense breast tissue on a mammogram, a small tumor may be missed. Who is more likely to have dense breasts? The density of your breasts can change over time. Generally, you're more likely to have dense breasts if you are younger, are pregnant or breastfeeding, are taking hormone replacement therapy, have a lower body weight. What should I do if I have dense breasts? Talk to your doctor about your personal risk of getting breast cancer. Dense breasts are just one of several risk factors for breast cancer. Your doctor will also think about other factors, like your age and family history of cancer. Different tests may be able to find some cancers that are missed on a mammogram. But these tests are more likely to have a false positive result. The test is reported as abnormal, but you really don't have cancer. False positive test results often lead to unnecessary tests, like a biopsy. Also, you may have to pay for these tests. Your doctor may suggest one of these tests. Breast ultrasound. A machine that uses sound waves to make pictures, called sonograms, of areas inside the breast. Breast magnetic resonance imaging, MRI. A kind of body scan that uses a magnet linked to a computer. The MRI scan makes detailed pictures of areas inside the breast. Talk with your doctor about how often you should be screened for breast cancer and which tests your doctor recommends. How is breast cancer diagnosed? Doctors often use additional tests to find or diagnose breast cancer. They may refer women to a breast specialist or a surgeon. This does not mean that she has cancer or that she needs surgery. These doctors are experts in diagnosing breast problems. Breast ultrasound. A machine that uses sound waves to make pictures, called sonograms, of areas inside the breast. Diagnostic mammogram. If you have a problem in your breast, such as lumps, or if an area of the breast looks abnormal on a screening mammogram, doctors may have you get a diagnostic mammogram. This is a more detailed X-ray of the breast. Breast magnetic resonance imaging, MRI. A kind of body scan that uses a magnet linked to a computer. The MRI scan will make detailed pictures of areas inside the breast. Biopsy. This is a test that removes tissue or fluid from the breast to be looked at under a microscope and do more testing. There are different kinds of biopsies, for example, fine needle aspiration, core biopsy, or open biopsy. Staging. If breast cancer is diagnosed, other tests are done to find out if cancer cells have spread within the breast or to other parts of the body. This process is called staging. Whether the cancer is only in the breast, is found in lymph nodes under your arm, or has spread outside the breast determines your stage of breast cancer. The type and stage of breast cancer tells doctors what kind of treatment you need. For more information, visit Stages of Breast Cancer. How is breast cancer treated? Breast cancer is treated in several ways. It depends on the kind of breast cancer and how far it has spread. People with breast cancer often get more than one kind of treatment. Surgery. An operation where doctors cut out cancer tissue. Chemotherapy. Using special medicines to shrink or kill the cancer cells. The drugs can be pills you take or medicines given in your veins, or sometimes both. Hormonal therapy. Blocks cancer cells from getting the hormones they need to grow. Biological therapy. Works with your body's immune system to help it fight cancer cells or to control side effects from other cancer treatments. Radiation therapy. Using high-energy rays, similar to X-rays, to kill the cancer cells. Doctors from different specialties often work together to treat breast cancer. Surgeons are doctors who perform operations. Medical oncologists are doctors who treat cancer with medicine. Radiation oncologists are doctors who treat cancer with radiation. For more information, visit the National Cancer Institute's Breast Cancer Treatment Option Overview. This site can also help you find healthcare services. Clinical trials. Clinical trials use new treatment options to see if they are safe and effective. If you have cancer, you may want to take part. Visit the sites listed below for more information. NIH Clinical Research Trials and National Institutes of Health. Learn about clinical trials, National Cancer Institute. Search for clinical trials, National Cancer Institute. clinicaltrials.gov, National Institutes of Health. Complementary and alternative medicine. Complementary and alternative medicine are medicines and health practices that are not standard cancer treatments. Complementary medicine is used in addition to standard treatments, and alternative medicine is used instead of standard treatments. Meditation, yoga, and supplements like vitamins and herbs are some examples. Many kinds of complementary and alternative medicine have not been tested scientifically and may not be safe. Talk to your doctor about the risks and benefits before you start any kind of complementary or alternative medicine. Which treatment is right for me? Choosing the treatment that is right for you may be hard. Talk to your cancer doctor about the treatment options available for your type and stage of cancer. Your doctor can explain the risks and benefits of each treatment and their side effects. Side effects are how your body reacts to drugs or other treatments. Sometimes people get an opinion from more than one cancer doctor. This is called a second opinion. Getting a second opinion may help you choose the treatment that is right for you. Triple-negative breast cancer. What is triple-negative breast cancer? Triple-negative breast cancer is a kind of breast cancer that does not have any of the receptors that are commonly found in breast cancer. Think of cancer cells as a house. The front door may have three kinds of locks, called receptors. One is for the female hormone estrogen. One is for the female hormone progesterone. One is a protein called human epidermal growth factor, HER2. If your cancer has any of these three locks, doctors have a few keys, like hormone therapy or other drugs, they can use to help destroy the cancer cells. But if you have triple-negative breast cancer, it means those three locks aren't there. So doctors have fewer keys for treatment. Fortunately, chemotherapy is still an effective option. A house. Think of a cancer cell as a house. To get inside to destroy the cancer, we must bypass three locks on the front door: estrogen, progesterone, and HER2. Three keys and open locks: estrogen, progesterone, and HER2. If your cancer tests positive for these three locks, which are known as receptors, then doctors have a few keys they can use to get inside the cell to destroy it. Three keys with no locks. If you have triple-negative breast cancer, those locks aren't there. So the keys doctors usually use won't work. But chemotherapy is still an effective option. How is triple-negative breast cancer treated? Often, patients first need to have the lump removed, a lumpectomy, or the entire breast removed, a mastectomy. Then they have chemotherapy treatments to target any cancer cells that can't be seen, cells remaining in the breast or that may have spread into other parts of the body. Sometimes doctors recommend chemotherapy before surgery to shrink the cancer. Lumpectomy. With lumpectomy, a surgeon removes the lump from your breast. He or she also removes nearby lymph nodes, the little oval-shaped organs that are part of your immune system, to see if the cancer has spread. The surgery takes an hour or two. Most women spend the day at the hospital and usually do not need to stay overnight. Mastectomy. For a mastectomy, your surgeon removes the breast and nearby lymph nodes to see if the cancer has spread. Some women choose to have breast reconstruction during the same surgery. Radiation. Lumpectomies are usually followed by radiation therapy. This is where high-energy radiation is given to your breast to kill any remaining cancer cells. It usually takes about 20 minutes per day. Most women go in 4 to 5 days a week for about 6 weeks. You'll see a radiation doctor to have this done. Chemotherapy. Cells from the cancerous lump may have spread somewhere else in your body. The goal of chemotherapy is to kill those cancer cells wherever they may be. Chemotherapy lowers the chance that your cancer will grow or come back. What are some common side effects of treatment? Hair loss. You may lose some or all of your hair within about 2 to 4 weeks of starting chemotherapy. New treatments may help with hair loss, so ask your doctor about that if it's a big concern for you. Your hair will grow back starting around 4 to 6 weeks after your last chemotherapy treatment. Nausea. Most women feel sick and exhausted for a day or two after each chemotherapy treatment. If you feel queasy, your doctor can give you a prescription for medicine to treat the nausea. Tiredness. You may feel tired or have problems with thinking and remembering things after chemotherapy and radiation therapy. Most of those side effects go away a few weeks after therapy ends. Lymphedema. If you have lymph nodes removed during surgery, or if you receive radiation treatment to your lymph nodes, the lymph fluid may not be able to drain properly. This may cause the fluid to build up under your skin and cause part of your body to swell. This condition is called lymphedema. Skin changes. On or around the skin where you've been treated with radiation, you may get some redness or peeling, kind of like a sunburn. Your doctor will tell you the best way to treat these skin changes. Do I need genetic counseling and testing? Your doctor may recommend that you see a genetic counselor. That's someone who talks to you about any history of cancer in your family to find out if you have a higher risk for getting breast cancer. For example, people of Ashkenazi Jewish heritage have a higher risk of inherited genetic changes, mutations, that may cause breast cancers, including triple-negative breast cancer. The counselor may recommend that you get a genetic test. If you have a higher risk of getting breast cancer, your doctor may talk about ways to manage your risk. You may also have a higher risk of getting other cancers such as ovarian cancer, and your family may have a higher risk. That's something you would talk with the genetic counselor about. Breast cancer in young women. Most breast cancers are found in women who are 50 years old or older, but breast cancer also affects younger women. While breast cancer diagnosis and treatment are difficult for women of any age, young survivors may find it overwhelming. CDC is working to increase awareness of breast cancer and improve the health and quality of life of young breast cancer survivors and young women who are at higher risk of getting breast cancer. Bring Your Brave. Bring Your Brave campaign. The Bring Your Brave campaign provides information about breast cancer to women younger than age 45 by sharing real stories about young women whose lives have been affected by breast cancer. Advisory Committee on Breast Cancer in Young Women. Advisory Committee on Breast Cancer in Young Women. The Advisory Committee on Breast Cancer in Young Women helps CDC develop evidence-based approaches to advance understanding and awareness of breast cancer among young women. Breast cancer in men. Although it is rare, men can get breast cancer. Learn about symptoms of breast cancer in men and things that may increase your risk. Breast cancer is most often found in women, but men can get breast cancer too. About 1 out of every 100 breast cancers diagnosed in the United States is found in a man. The most common kinds of breast cancer in men are the same kinds in women. Invasive ductal carcinoma. The cancer cells begin in the ducts and then grow outside the ducts into other parts of the breast tissue. Invasive cancer cells can also spread or metastasize to other parts of the body. Invasive lobular carcinoma. Cancer cells begin in the lobules and then spread from the lobules to the breast tissues that are close by. These invasive cancer cells can also spread to other parts of the body. Ductal carcinoma in situ, CIS, is a breast disease that may lead to invasive breast cancer. The cancer cells are only in the lining of the ducts and have not spread to other tissues in the breast. What are the symptoms? The most common symptoms of breast cancer in men are a lump or swelling in the breast, redness or flaky skin in the breast, irritation or dimpling of breast skin, nipple discharge, pulling in of the nipple or pain in the nipple area. These symptoms can happen with other conditions that are not cancer. If you have any symptoms or changes, see your doctor right away. What are the risk factors? Several factors can increase a man's chance of getting breast cancer. Having risk factors does not mean you will get breast cancer. Getting older. The risk for breast cancer increases with age. Most breast cancers are found after age 50. Genetic mutations. Inherited changes, mutations, in certain genes, such as BRCA1 and BRCA2, increase breast cancer risk. Family history of breast cancer. A man's risk for breast cancer is higher if a close family member has had breast cancer. Radiation therapy treatment. Men who had radiation therapy to the chest have a higher risk of getting breast cancer. Hormone therapy treatment. Drugs containing estrogen, a hormone that helps develop and maintain female sex characteristics, which were used to treat prostate cancer in the past, increase men's breast cancer risk. Klinefelter syndrome. Klinefelter syndrome is a rare genetic condition in which a male has an extra X chromosome. This can lead to the body making higher levels of estrogen and lower levels of androgens, hormones that help develop and maintain male sex characteristics. certain conditions that affect the testicles. Injury to, swelling in, or surgery to remove the testicles can increase breast cancer risk. Liver disease. Cirrhosis, scarring, of the liver can lower androgen levels and raise estrogen levels in men, increasing the risk of breast cancer. Overweight and obesity. Older men who are overweight or have obesity have a higher risk of getting breast cancer than men at a normal weight. What can I do to reduce my risk? If several members of your family have had breast or ovarian cancer, or one of your family members has a known BRCA1 or BRCA2 mutation, share this information with your doctor. Your doctor may refer you for genetic counseling. In men, mutations in the BRCA1 and BRCA2 genes can increase the risk of breast cancer, high-grade prostate cancer, and pancreatic cancer. If genetic testing shows that you have a BRCA1 or BRCA2 gene mutation, your doctor will explain what you should do to find cancer early, if you get it. All men can lower their risk by keeping a healthy weight and being physically active. Audio description: low-resolution video. As a neurosurgeon, Don knew everything in life and in surgery is all risk versus benefit. After discovering his family history of breast cancer, he took responsibility for his own health by getting tested and later having an elective mastectomy. How is breast cancer treated? As in women, treatment for breast cancer in men depends on how big the tumor is and how far it has spread. Treatment may include surgery, chemotherapy, radiation therapy, hormone therapy, and targeted therapy. For more information, see the National Cancer Institute's Male Breast Cancer Treatment. What CDC is doing about breast cancer. Breast Cancer Disparities Toolkit. The ASTHO Breast Cancer Disparities Online Toolkit provides resources for identifying, measuring, and addressing disparities in avoidable deaths from breast cancer among different groups of women. It is designed to provide state and local health departments, cancer registries, healthcare providers, healthcare payers, and community partners with a roadmap for reducing breast cancer mortality among groups of women who experience inequities in healthcare. It was developed with funding and support from CDC. Breast cancer in young women. CDC works with public, nonprofit, and private partners to address breast cancer in women younger than 45 years of age through a variety of activities, including our Bring Your Brave campaign, which provides information about breast cancer to women younger than age 45 by sharing real stories about young women whose lives have been affected by breast cancer. The Advisory Committee on Breast Cancer in Young Women, which provides guidance regarding development, implementation, and evaluation of evidence-based activities aimed at prevention, early detection, and survivorship. The Cancer Genomics Program, which develops best practices in education, surveillance, and policy and systems change approaches, and establishes an evidence base for the application of family history and cancer genomics in public health practice. Activities focus on hereditary breast and ovarian cancer syndrome and Lynch syndrome. Surveillance. Cancer surveillance is the collection of information about cancer, including which groups of people were diagnosed with breast cancer, how far the breast cancer had spread at the time it was diagnosed, how the cancer was treated. This information allows scientists to see how breast cancer rates change over time and whether more women are being diagnosed before their cancer has spread. See which groups of people are more or less likely to get breast cancer. Plan cancer prevention and control programs and determine if they are working. CDC supports cancer surveillance through National Program of Cancer Registries, NPCR. Funded by CDC, this program collects information about cancers diagnosed in the United States through central cancer registries. This information is used in breast cancer research and to answer community questions and concerns about breast cancer. Behavioral Risk Factor Surveillance System, BRFSS. The BRFSS is the world's largest ongoing telephone health survey system that gathers information on health risks in the United States. Information is collected about health behaviors like exercise, diet, smoking, and drinking alcohol and other factors that may affect a person's risk of getting cancer. The BRFSS also collects information about how many women have been screened for breast cancer. National Health Interview Survey, NHIS. This survey collects information about a broad range of health topics, including information about breast cancer screening and risk factors for breast cancer. Research. CDC's Division of Cancer Prevention and Control supports studies that help improve efforts to prevent and control breast cancer. See CDC's Breast Cancer Research. Supported by CDC, the Guide to Community Preventive Services reviews research to decide which strategies increase breast cancer screening. Community programs. CDC supports many programs designed to prevent or control cancer. CDC's National Breast and Cervical Cancer Early Detection Program provides quality breast and cervical cancer screening and diagnostic services to low-income, uninsured, and underserved women and supports strategies to increase screening rates in health systems and communities. These services can help find breast and cervical cancer at the earliest stages. CDC's National Comprehensive Cancer Control Program helps communities combine resources so they can develop and implement strategic plans that help lower the number of people getting cancer and help people with cancer get better treatment and have a better quality of life. CDC's Division of Nutrition, Physical Activity, and Obesity helps people be physically active and stay at a healthy weight, which can help lower the risk of chronic health problems like breast cancer. CDC's National Office of Public Health Genomics examines the ways that research in human genetics can be used to improve health and prevent disease, including breast cancer. Cigarette smoking and breast cancer. Identification of breast cancer as the most important cancer in women, and exploring its risk factors have interested researchers for many years. 40. However, the role of cigarette has not been considered as a cause until recently. 41. Increased incidence of breast cancer parallel with lung cancer in women in recent decades have attracted researchers towards increased rate of female smokers, aiming at finding a similar cause for this ascending trend. It is almost for 2 decades that researchers have addressed the relationship between breast cancer and cigarette smoking, leading to at least 22 published articles only by the late 80s. Different studies have suggested a weak relationship, lack of relationship, or supportive effect. The emphasis of these articles has been on active cigarette smoking and breast cancer. Investigation into indirect correlation of cigarette smoking with breast cancer has been less undertaken, but has delivered fixed results. Women exposed to cigarette smoke during childhood or married to a cigarette smoker are more prone to breast cancer. 42, 43. In a meta-analysis by Kuter et al. Into indirect exposure to cigarette smoke and the risk of breast cancer, a weak relationship was found. Therefore, further studies are required to prove this causal relationship. 44. Results of Reynolds et al.'s study on 116,544 women showed increased chance of developing breast cancer in cigarette smokers, corroborating the role of cigarette in breast cancer etiology. 45. Rousseau et al. Determined the susceptibility of breast tissue through growing and differentiating it. 46. Breast cells differentiated from the parts 1 and 2 are susceptible to chemical mutagens that occur before menopause, whereas those differentiated from the part 3 are mutagen immune. According to this study, it is supposed that exposure period to breast carcinogens determines susceptibility to carcinogenesis. For example, an early exposure, especially before the first pregnancy, may end in breast cancer due to genotoxic mechanisms, whereas the subsequent exposures have protective effects because of antiestrogenic characteristic of cigarette. However, it should be considered that the duration of cigarette smoking may neutralizes this effect. As a result, it is very important to determine whether the exposure to cigarette smoke was direct or indirect. The discovered relationship of cigarette smoking with breast cancer, 1984, confirmed this protective effect, 47. A study, 1990, showed that the relative chance of developing breast cancer in cigarette smokers versus non-smokers was 1 in 12 in case studies and 1 in 14 in cohort studies, 48. The onset of smoking in younger age increases the risk of cancer breast. Women who started smoking at 10 to 14 years were more prone to breast cancer, 49. The risk of breast cancer is higher in women with family history of breast cancer, ovarian cancer, or both, 50. In 1940, research findings showed that increased use of fat leads to breast tumor in animals, 53. Howe and Goodwin reported a positive correlation between high fat intake and the risk of breast cancer, 54. Another study reported a positive significant relationship between animal protein intake and the risk of breast cancer, 55. In general, the relationship with the risk of breast cancer development is uncertain, 56. On the one hand, calorie intake leads to weight gain and obesity. On the other hand, it results in increased height in childhood and preterm menopause. Both factors can establish the context for cancer development in future, 57. BRCA1 and breast cancer. The main risk factors of non-genetic breast cancer have hormonal origin. For example, gender, the age at menarche and menopause, reproductive history, breastfeeding, and the use of exogenous estrogen, with external origin, can be mentioned. In most cases, non-genetic breast cancer occurs among menopausal women who have high expression of estrogen receptor. Estrogen has at least two main roles in breast cancer development. 1. Estrogen metabolites can mutate or generate DNA-damaging free radicals, 58, and 2. Estrogen can proliferate cells in precancerous and cancerous lesions through its hormonal activity. In addition, since an important part of breast carcinoma is estrogen receptor negative, or ER, other mechanisms are also involved in the development of breast cancer, 59. Mutation of BRCA1 raises the risk of breast cancer to 51% and 85% by the age 50 and 70 years, respectively. It also raises the risk of ovarian cancer to 23% and 63% by the age 50 and 70 years, respectively, 60. Immune system and breast cancer. The immune system is totally able to combat tumors, and many immunological parameters applying cytokines, for example IL-12 and IFN-gamma, play major roles in this regard. IL-12 is also the major cytokine responsible for the differentiation of Th1 cells, which are potent producers of IFN-gamma. IFN-gamma in turn has a powerful enhancing effect on the ability of phagocytes to produce IL-12, as well as having an important role in cellular immune response. 61. Breast cancer in Iran. The incidence of this disease is about 20 in 1,000 per year in Iran. Therefore, the probability of new cases with breast cancer is 6,000, almost 1 in 10, out of 30 million women in the country, 62. Although Iran has lower incidence of breast cancer, as compared to other countries, recent increase of this problem has turned it into the most common type of lesion among Iranian women. This cancer affects Iranian women at least 1 decade earlier than their counterparts in developed countries. More than 30% of the patients are younger than 30 years, 63, 64. Methodology. In this article, required information was collected through literature review and keyword, cancer, breast cancer, cell, gene, life quality, women, prevalence, productivity, age, obesity, alcohol, cigarette, menopause, genetic, cytokine, and mortality. Querying credible scientific websites such as SID, Google Scholar, and comprehensive portal of human sciences. Go to. Conclusion. Breast cancer was and continues to be among the most prevalent and growing malignant diseases among Iranian women in the past 4 months. Breast cancer is a disease that involves the patient, family, and community, and wastes many financial and spiritual resources. This cancer is developed in breast tissues including ducts, tiny tubes that carry the milk, and lobules, milk-producing glands. Breast cancer is not gender-specific, but rarely develops in men. Although the exact cause of breast cancer is unknown, specific risk factors have been identified. Different types of cancer have different risk factors. Some of these risk factors such as cigarette smoking, alcohol use, and diet can be changed and depend on lifestyle. However, other factors like age, race, gender, and family history are fixed and unchangeable. Having one or more of these risk factors does not necessarily mean infliction. Although many of these risk factors increase the chance of breast cancer development and progress, its exact mechanism is not clear. It seems that hormone plays a very important role in some types of breast cancer, however, its development and progress mechanisms are not very clear. In general, it can be said that such factors as aging, history of breast cancer development in family, certain changes in breasts, genetic changes, history of productivity and menopause, lack of physical activity, alcohol use, diet and nutrition, race, and radiation therapy to chest are risk factors of breast cancer. This disease affects different physical, mental, and social aspects of women's life. On the other hand, such factors as social and family supports during the illness can reduce its negative impacts.